dentinogenesis imperfecta. This is a genetic autosomal dominant condition that affects the formation of dentin in teeth. So in this condition, the dentin forms the bulk of tooth structure, and this is the part that's affected. In this condition, the enamel can easily separate from the defective dentin, leading to enamel loss or detachment from the underlying tooth structure. Notice how the enamel is lost in this picture. Just like amelogenesis imperfecta, dentinogenesis imperfecta is inherited as an autosomal dominant trait and also causes disturbances in the Bell stage of tooth development. So dentinogenesis imperfecta has some common radiographic features. Some of these include short roots, which we can see here. We also can see a constricted DEJ, which we notice here. An obliterated pulp chamber. You can notice how we cannot trace the pulp chamber here. And bulbous or bell-shaped crowns, noticed here. So similar to amelogenesis imperfecta, dentinogenesis imperfecta affects both the primary and permanent teeth. Additionally, similar dental changes may be observed in individuals with osteogenesis imperfecta, which is a genetic disorder characterized by brittle bones. One key feature of osteogenesis imperfecta is that it's often tested on our exams with the presence of blue sclera of the eyes. So next we'll discuss dentin dysplasia. This also alters dentin and may be inherited as an autosomal dominant condition. This condition can affect both the primary and permanent dentition. So there's two main types of dentin dysplasia. We have type 1, which is radicular, and type 2, which is coronal. So let's start with type 1 with this image on the top. So type 1 affects the radicular dentin of the teeth, resulting in short roots and chevron-shaped pulps. This is often accompanied by a premature mobility and exfoliation of the teeth. Loss of organization of root dentin can also be found, but the enamel and dentin are clinically normal. So again, these teeth may develop tooth mobility, premature exfoliation, and malalignment. So let's move on to type 2. Type 2 is coronal dentin dysplasia, which affects the coronal dentin and is clinically determined by its thistle-shaped pulps, bulbous crowns, and thin roots. It can also be considered a form of dentinogenesis imperfecta. So treatment options for these conditions are limited as these teeth are not well suited for proper restorations. Next, we have regional odontodysplasia. So this is a condition that affects the formation of enamel, dentin, and pulp tissue. As the term suggests, the condition is regional, affecting specific regions and typically quadrants of the dentition rather than the entire mouth. It's typically characterized by ghost teeth as seen in this x-ray. So some common features of odontodysplasia include short roots, open apices, and enlarged pulp chambers, which we can see here in this radiograph. This affects both the primary and permanent teeth. So treatment includes supporting eruption to promote healthy alveolar bone and then extracting affected teeth once the teeth are erupted. Next, we'll discuss concrescence. So this can be characterized by the union of adjacent teeth by cementum overlying the roots. Look at how these teeth appear that they're glued together. So it's commonly associated with hypercementosis, which is an excessive deposition of the cementum. This dental anomaly can lead to various complications, including occlusal disturbances, difficulties with eruption, and challenges for extraction procedures. The prevalence is about 0.04%, and it's most likely to affect the maxillary second and third molars. Finally, we'll discuss enamel pearls. So enamel pearls can be defined as ectopic globules of enamel typically found on the root surface of the teeth. And we can see one right here in this furcation area. So the presence of enamel pearls consequently blocks the attachment of Sharpie's fibers. This can result in periodontal pocketing, exposing the tooth roots and making them more susceptible to localized periodontitis and other dental problems in these areas. This may be involved with the enamel only, or these may actually contain dentin and pulp tissue. Enamel pearls typically appear round, white, smooth, and glass-like, and can affect a primary and permanent teeth. It's most likely to be affecting the maxillary second and third molars as well. Treatment for this includes supporting eruption to promote healthy alveolar bone and then typically extracting affected teeth once they've erupted or monitoring these.